So here we go with the arousal theories revision screencast. So arousal is a topic that we sometimes mix in with anxiety, but the arousal side of the stress topic is more around the theories. So try and get that in your head now, that arousal questions are going to be around the theories and the graphs. So, in terms of what actually is arousal, you could do with a quick definition and the types and the impacts of any high arousal on performance. Quickly jot those down. So arousal it can be described in a few different ways, but I like the word activation, how activated someone is, the level of excitement maybe you could use as well, but that level of activation that goes from kind of deep sleep to being highly excited is a good way to describe what arousal is. And similar to anxiety, we have cognitive arousal and we have somatic arousal as well. So we should be familiar with what those two words mean. So the cognitive, obviously, around how awake and alert we are, and somatic with our physiological symptoms in terms of things like heart rate, sweating, etc. So impacts of high arousal, I mean, one of the main things is that the dominant response is going to take over, and we'll talk about that in a second in a bit more detail. But obviously this does depend on the type of task we're doing. It depends on the performer, but it's going to increase those levels of activation and have some sort of an impact. And obviously arousal links into lots of the other topics that we talk around. So in terms of theories, we have drive theory. So quickly sketch the graph, and can you get the main concept of drive theory that kicks in with high arousal? So drive theory basically suggests that as arousal increases, performance increases in a linear fashion. But the other thing to take into account here is that with high arousal we get this dominant response takes over. So the dominant response is a dominant habit. It's the most likely or well learned response. So this does depend on the type of performer. So always use as your examples. Use an example of a novice and use an example of an expert. So a novice's dominant response is well learned. Is not well learned. Scrub that out. Novice is not well learned, whereas an expert's dominant response is well learned. So basically we get with high arousal, an expert will handle that arousal and their dominant response being good will perform well, and the novice with a not well learned dominant response will perform badly. So we can see a typical question here, explain why performers might perform badly due to their levels of arousal. So in terms of drive theory, we get this idea of trying harder, but the key points coming in that dominant response kicks in, and then using our example of a novice, of a beginner, that we get negative effects so that we don't perform very well, and that's because their dominant response is not correct. Link it to a complex or simple task as well. Complex task is more likely to have that effect. And another point here, if we know about our audience topic, that we can link it to evaluation apprehension as well. So inverted U theory, again, just sketch the graph and a couple of key points around inverted U. So inverted U theory, so performance increases as arousal increases up to an optimal point, which is in the middle here, with middle levels of arousal, where our best performance takes place according to inverted U theory. Once we get over aroused, then we see a gradual deterioration in performance, with higher levels of arousal reducing the performance. Make sure you, in terms of questions around the theories, make sure that you describe what's happening on the graph. You can pick up the points here, so like as is the points on here, so that performance increases as arousal increases, that there is an optimal point, and that as over arousal occurs, that performance goes down. You can basically get that from the graph, so always describe what's going on in the graph. Pushing this on a little bit, we have a second theory that's related to inverted U theory, which is the eyes off the individual zone of optimal functioning. And as you can see here, that this is suggesting that different performers will have different zones where their best performance takes over. So different performers here, 3 different performers, one who would perform well with high levels of arousal here, someone with middle levels of arousal, like the inverted U theory, and someone with lower levels of arousal down here. And I think we can relate to this, that this is the case, and that some people do perform best, say down here where they're more calm, and some people need to be really up for it up here to perform at their best. This on, the eyes off theory suggests that there are 3 main types of factor that affect where the optimal level of arousal is. So these are to do with personality, the task we're doing or the skill we're doing, and our levels of experience. So just quickly jot down now how those 3 factors affect performance in terms of arousal. Okay, so I'm hoping that we've been talking about up here about introvert and extrovert. So difference between different types of personality. So introverts like a lower level of arousal, whereas extroverts seek high levels of arousal. They perform best with high levels of arousal. So the task we're doing is whether that is simple or whether it's complex. So a simple, gross type of a task is performed well with high levels of arousal. Complex tasks where perceptual factors are involved, and we've got to think and be accurate, fine skills that we've normally open, that we've better off performing with lower levels of arousal. And the stage of experience, so the autonomous performer, like Roger Federer over here, can handle the high levels of arousal. Doesn't mean that they actually seek those out, but they can handle the high levels of arousal, whereas the cognitive learner needs low levels of arousal because they've got to think about what they're doing anyway. So you can see that this question links the inverted U theory to optimal levels of arousal, and that it actually says different optimal levels of arousal. So what the question's done there, it's linked the 2 theories. It hasn't mentioned eyes off, but you can see that the answers that we're getting here for skill levels and for the types of skill here and the personality, that these are the different factors that affect where your optimal level of arousal is. So sometimes you've got to take information into a slightly different question depending on how the question is being asked. So the next theory is around the concept of, we sometimes call it peak flow, or the exam board sometimes call it peak flow, or just flow. So flow is said to happen up in this top box here where we are excited and happy, and you can see that what we're looking at is the relationship between somatic arousal and cognitive anxiety as well. Flow happens when we have our best arousal levels, so we're in our zone basically. That we have a high incentive value, and if you know around your situational factors from achievement motivation theory, then you know what high incentive value is. We're highly focused, so we're concentrating with our appropriate style, so thinking about NIDF's styles, broad and internal, etc. That we're highly confident, and that we're well prepared in terms of our training, etc. So you can see again a typical question just identifying those characteristics of peak flow. So we can see similar answers to what we're talking about. The focus, it's also effortless, which is an extra one that we have clear goals as well. The confidence, and that it happens automatically, and that we're in our levels, our best levels of arousal. So flow is said to be the once in a lifetime experience where everything happens so well that we perform really easily, effortlessly. It happens in slow motion. It's a perfect performance where everything feels great. So catastrophe theory actually has two graphs, although we'll only really concentrate on one, but just to kind of show you that the difference between the first graph, it kind of goes like this. It has like a low inverted U type of shape, so that because it combines arousal and anxiety, so we're looking at arousal and anxiety put together here. So you can see here that we have low levels of cognitive anxiety for this graph. What the theory says is that we can only get up to a certain point of performance, not very high, in other words, with low cognitive anxiety, with that inverted U type of a shape. The main graph that you need to be aware of is the one on the right that has high cognitive anxiety. So this is likely to be an important game, an important competition, an Olympic final, for example. And what we're saying is you're gonna have some high cognitive anxiety. You're gonna have those worries in your head around performance, etc. And what Hardy suggests is that with that in mind as the context, that the relationship between arousal and performance goes something like this, so that it goes up, and you can see, so the first difference is that we're able to get a best performance if we can control our arousal. And that's key. So we often see that in big games and in Olympic finals, etc., that people who can control their arousal levels and their excitement can actually perform really well. And we might see, for example, world records being broken. However, if we get over-aroused, we don't just go down, as inverted U theory would do, like this, that something a bit more dramatic is going to occur, and that a catastrophe actually occurs. So, in other words, we have an absolute nightmare. So with over-arousal, with the high cognitive anxiety, those two things combine, and we get this catastrophe occurring. Now, the last bit is that Hardy suggests that two things can then happen. We can either stay highly aroused and performance continues to suffer, or that we can actually, if given appropriate time, etc., we can lower down our arousal and actually work our way back up to a good performance if we're allowed time to recover. So this would need time. It would need a break in play, for example. It might need a half time, etc., and obviously that wouldn't be appropriate in every sport, but if you had the chance to do that can actually happen. So again, a typical example, it asks you to use catastrophe theory and describe how over-arousal can affect the performance. So you can see that we do get credit for looking at optimal levels of arousal for their best performance, but the over-arousal, so again, describing what happens with the graph is useful, actually causes a decrease in performance. The bits about recovering and the linking it to the cognitive anxiety are also going to get you credit. So you can see again, looking at the two things combined here. So that's our arousal theory. So just a quick recap, just quickly recap on a description of arousal and the two types. And look at the theories. So just jot down the main theories. And if you can, try and have up your sleeve 3 to 4 points on each theory. So remember, we're looking at drive, inverted U, eyes off, peak float and catastrophe. Know your theories inside out. Describe what happens in terms of the theories, how the arousal affects performance, and have 3 to 4 points for each one up your sleeve. Remember that we also need to look at stress management, and again we'd look at our cognitive and somatic techniques here that would link to this, so refer to that screencast as well. Thanks for listening.